Muted.
Again, thank you, everyone. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. Attendees will be asked also to complete an evaluation poll question at the end of this webinar. Please let us know how we are doing. Your feedback is vital to helping us craft presentations that meet your needs. Also, this webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars. For our objectives for today, we expect by the end of this webinar, you will be able to learn about common environmental asthma triggers and how they impact asthma, how to address them. Let's discuss 5 major strategies that school-based health center staff can use to work with schools and families in our community to reduce environmental asthma triggers. Also, share case studies, examples, tools, curricula, and resources to help school-based health center staff implement environmental trigger reduction interventions. Now, I will introduce our presenters for today. First, we have Ms. Ann Kelsey Lamb. She is the Director of Regional Asthma Management and Prevention, a position she has held since 2002. She leads all components of the organization's efforts to reduce the burden of asthma, including technical assistance to community-based asthma coalitions, the provision of clearinghouse of information on asthma, convening groups to facilitate networks and capacity building and creating change through policy advocacy. Next, we have Ms. Janine Saunders. She is a Senior Project Director at the California School-Based Health Alliance, a School-Based Health Alliance affiliate. Janine is responsible for working with California School-Based Health Centers to increase school integration and maximizing the School-Based Health Center's impact on student health and learning. Now, we would like to start off with a poll question. Our first question is, which of the following is a common asthma symptom? Please take a few moments to answer the question. Okay, 5 more seconds. Okay, so we have 74% said all of the above. Thank you, everyone, for participating in this first poll question. Now, I would like to present to you Ms. Ann Kelsey. All right, Ann. Thank you so much today. And we can't hear you at the moment. And we think you're on mute. Can you unmute your phone for us?
Tiara, this is Janine. Can you hear me?
I can. How are you, Janine? Yes.
I'm great. If Anne is not able to connect via audio in the next couple of seconds, I'll just go ahead and get us started.
Okay. Thank you.
Hi, can you hear me now?
We can.
We can.
Fantastic. I am so sorry, everyone. I don't know what happened, but here I am, and thank you all for joining us this morning or this afternoon, wherever you may be. I assume that because you're participating on this webinar, you're all concerned about asthma, and you know that it is a chronic inflammatory disease of the airways characterized by episodes of wheezing, shortness of breath, and coughing. Asthma symptoms are triggered by a variety of environmental factors, allergens like pollens and cockroaches, and irritants like tobacco smoke and air pollution. These environmental asthma triggers cause inflammation, obstruction, and constriction of the lungs' airways, making it difficult and sometimes impossible to breathe. So reducing or eliminating exposure to these triggers is essential for improving a patient's ability to manage their asthma symptoms. Okay, I'm trying to advance my slide, and I see it is not happening, Tiara. I'm hoping you can help me. Let's see. Okay, there we go. So asthma affects 7 million children under the age of 18 in the United States. It is the most common cause of disability among children in the U.S. and the leading cause of school absences due to chronic disease. Asthma affects children of all ages, races, and ethnic groups. However, asthma is a disease in which we see significant disparities. What you see on the slide in front of you is asthma prevalence based on different characteristics. And the yellow bars show where we see the significant disparities, where we see the greatest prevalence. So that is in Black non-Hispanics, in Puerto Ricans, and in people living below 100% of the poverty line. The one thing that I like about working on a public health issue like asthma that is so prevalent is that we know a lot about how to improve the disease. There are some very clear solutions and a great deal of evidence about what works. There are very clear national guidelines, and if we follow these guidelines, we should be able to achieve the goal of every child with asthma having well-controlled asthma. So what you see on your screen now are the 4 recommendations, the 4 vital components of asthma management that are part of the national guidelines. They are assessment of disease severity and control, comprehensive pharmacologic therapy, patient education, and environmental control measures to avoid or eliminate factors that contribute to asthma onset and severity. These last 2, the ones highlighted in red, are what we're going to be talking about primarily today. And it's also very noteworthy that these are the 2 components that patients are the least likely to have access to. And this is particularly a concern for low-income patients and minority patients, and that's contributing to some of the disparities that we see. So by increasing access to these 2 vital components, we can not only improve overall asthma outcomes, but start to reduce some of the disparities gap as well. So before we go on, I want to highlight just how important the role of school-based health centers is in managing asthma. Studies show that school-based health center users are less likely to go to the emergency department or be hospitalized for asthma, less likely to have asthma-related restricted activity days, and less likely to miss school as a result of their asthma. So we at RAMP and our colleagues at the California School-Based Health Alliance received a grant from the U.S. Environmental Protection Agency to support school-based health centers in working on asthma environmental interventions. While many school-based centers across the country are already playing a key role in helping students manage their asthma by providing quality clinical care and education, there is an opportunity for school-based health centers to also be leaders in managing the environmental factors that make asthma worse. So we developed a guide, pictured here, and the URL is posted for those of you who are interested in checking it out on our website. And this guide describes the type of environmental interventions that school-based health center staff can initiate, lead, or otherwise support to help children breathe better. So the whole underlying premise of the guide and of our grant from the EPA is that we believe school-based health centers provide an ideal setting in which to incorporate environmental components into chronic disease management programs. That you have a unique role as a strong link between the student, school, and home. And by leveraging this role, you can have a significant impact. So the rest of this webinar, what I'm going to do is provide a quick overview of environmental asthma triggers, and then my colleague Janine and I will cover the 5 strategies that we address in our guide and provide some examples and specifics, and then we'll end with some opportunities for those of you that are more interested in engaging further in this work. Okay, so we have a poll question now. Tiara, do you have that?
Yep, I'm sorry. Which of the following are common environmental asthma triggers? And would you take a few seconds to answer the question for us? Okay, 5 more seconds. Okay, so what we have so far is 100% said all of the above for our poll results.
Fantastic. Well, clearly you all already know quite a bit about this topic, so I will quickly go over this so we can then start getting more into the strategies and activities we can use to address these triggers. But a couple of things that we need to know about environmental asthma triggers. First, there are 2 main categories, allergens and irritants. Allergens cause the body to mount an inappropriate immune response to a benign protein or allergen. Allergic reactions are caused by the body's own immune system. An irritant is a substance that causes inflammation and discomfort in the body. This reaction is not primarily a result of the body's immune system. So an allergic reaction requires prior sensitization, whereas an irritant does not. The second thing is that it's important to understand the difference between exacerbation and causation. Environmental asthma triggers, by definition, can trigger asthma symptoms or make asthma worse, which is exacerbation. Some of the environmental asthma triggers may also increase a child's risk of developing asthma in the first place, which is causation. So in the guide, we provide examples in which the scientific literature has demonstrated or suggested causation. But basically, I wanted to point out that it's important to know that there is a distinction and to know that some of these triggers can indeed cause asthma. And of course, the science is always evolving on this. And then a final important consideration is that people with asthma may react to just one trigger, or they may find that several things act as triggers. And it really varies from one person to the next, which is why it's important to work closely with your patients to understand what their specific asthma triggers are. So now we're going to quickly go through some of the common asthma triggers that your patients may be exposed to. Here we see a picture of mold, and then dust mites are everywhere in schools and homes. But they particularly gather in places where we see a lot of clutter, rugs, upholstery. So here, what looks like a very cozy reading nook in a school can actually be a great source of dust mites, which can serve as an asthma trigger. We know that, of course, pests like cockroaches and rodents are asthma triggers. Pets, primarily furry pets, and then pollens. And the pollens vary from region to region and person to person, but again, a common asthma trigger. Now, switching to irritants, I think most of us are already aware that environmental tobacco smoke is an asthma trigger, and indeed this is also one linked to causation. But many people aren't as aware that there are chemical irritants from personal products, like perfume or scented laundry soap, can also trigger asthma attacks. Cleaning products, a lot of the traditional and very common cleaning products like bleach can trigger asthma attacks, and there are safe alternatives, which we'll talk more about later. And then pesticides. We know that the pests trigger asthma attacks, but the chemical pesticides do as well. So again, we'll talk about alternatives. The nitrogen dioxide from gas stoves and space heaters and the particulate matter from wood smoke can also serve as asthma triggers. And then lastly, we have outdoor air pollution from a variety of sources. We have here a picture of a port and lots of diesel-operated trucks, common industry, traffic congestion, and then agricultural pollution or construction pollution. Okay, so in the guide, we discuss 5 main strategies for how school-based health center staff can engage in reducing exposure to the environmental triggers that I just described. We go in depth in the guide, but there is also this at-a-glance sheet toward the back of the guide that you can cut out, or if you're printing it, print it out and have to really start conversations and start thinking about which strategy is going to be the one that's best for your school-based health center. So now I'm going to turn it over to my colleague, Janine, to talk about the first couple of strategies, beginning with education.
Thanks, Anne. As we transition, Tiara will be giving us another poll question. And this one is related to how often you talk with your patients with asthma about environmental asthma triggers.
Yes, our next question is, how often do you talk to your patients with asthma about environmental asthma triggers? And if we all can take just a few seconds to answer the question. Five more seconds. Thank you, everyone. Okay, 70% of you said always. And 30%.
Awesome. Thanks, Tiara.
You're welcome.
So I'm glad to hear that 70% of you talk with your patients about environmental triggers related to their asthma. It's so important. And Tiara did a great job with the intro. Thank you so much. I would also like to say, you know, in addition to working with asthma professionally, I'm also the parent of a 10-year-old boy who has asthma. So I feel like I have professional and personal experience with asthma. And in particular, with learning about my own son's environmental triggers and working to reduce those in his environment. So the first strategy we're going to talk about is strategy 1, education. So when you download your copy of the guide, because I know that's the first thing everyone will do at the end of this webinar, the first section of the guide talks about one-on-one education, group education, providing education for school staff, and then ordering materials to share with students, families, and staff around the school. And providing education to the school site is something that school-based health center staff are especially well positioned to do. So I'm going to start by talking about one-on-one education. So during patient visits, teaching young people about what their asthma triggers are as well as how to recognize immediate and delayed reactions as a result of encounters with triggers is very important. The EPR3 guidelines, National Guidelines for Asthma Care, really describe asthma education as an essential component of asthma management. And teaching patient strategies for reducing exposure can really help them reduce their their symptoms and help them avoid those things that make their asthma worse. So using an asthma action plan that includes trigger information is a really great way to get students talking about triggers. I'm sure that many of you already use asthma action plans, so I would encourage you to go to your asthma action plan and take a look and see if that plan includes trigger information. And if it doesn't, you may want to consider switching to an asthma action plan that does. In the guide, there are links to asthma action plans that do include trigger information. In addition to one-on-one education during clinic visits, there are also lots of great evidence-based programs for supporting group education for students. So we've listed several here, elementary age programs and middle and high school age programs that have all been evaluated and shown to be effective in improving knowledge, reducing missed school days, reducing asthma symptoms, and improving health outcomes. And this list is certainly not meant to be exhaustive. There are many great resources out there, and maybe if some of you out there are using other resources that you'd like to let us know about, you can do so in the chat box. But this is a good starting point for thinking about group education at your school. In addition to educating students with asthma, you want to think about providing education for school staff as well. And we've shared a couple of resources here. I highly recommend the Asthma Quick Takes. So if you look in the bottom middle of your screen, you'll see a screenshot of the quick takes that were developed by our friends at the School Environmental Health and Asthma Collaborative. There's one quick take in particular related to asthma in schools that talks about reducing exposures to indoor asthma triggers. The quick takes are really short videos. They're about 5 minutes long, and it's something that you could use perhaps during a staff meeting or some other time when you as school-based health center staff are sharing information with the broader school community. Finally, I just want to draw your attention to educational materials that are free and low cost that you can print and order and distribute them to others. There's also in the guide some links to free online games that can help students learn about asthma. So in the bottom right-hand corner, you'll see a screenshot from this Arthur Family Health game that includes modules on asthma, peanut allergies, and other health topics that young people can go online and play so they can start to learn more about their asthma and learn more about managing their symptoms. So as a real-world example, I want to talk a little bit about West Oakland Middle School. So for those of you who are familiar with Oakland, you know that Oakland has the second busiest port on the West Coast, second only to Los Angeles. So literally thousands of diesel trucks are moving through West Oakland every day as they're moving those containers off the ship. Students in West Oakland, really all residents of West Oakland, have a disproportionately high rate of asthma, in part because of the activity of the port in that community. The school-based health center at West Oakland Middle School worked with the school district nurse to get names of students who had asthma, and also they are engaging in screenings to identify undiagnosed students. And once they've identified those students, they're providing group education led by an AmeriCorps Vista team member who they have at their school-based health center. And the group education includes information on triggers in the home and the school, as well as triggers in the outdoor community, and includes information for students on what they can do to reduce exposure to those triggers. Also, West Oakland Middle School is a part of our California Asthma Learning Collaborative, and at the end of the webinar, I'm going to talk a little bit more about our National Learning Collaborative and how you and your school-based health center can get involved in this work. Okay, now I'm going to move on to strategy 2, case management. And this is just a reminder that if anyone has questions, you can type them in the chat box or you can type them in the question box. So strategy 2 is around case management. And we know that children with asthma benefit greatly from proactive case management. And that's often a role that can be filled by school-based health center staff. So the 2 strategies we're going to be talking about are reducing exposure to environmental triggers using case management and facilitating connections with resources that exist to help students who may need a little bit more assistance or a little bit more advocacy to reduce triggers. So first, we want to talk about using case management to communicate, educate, identify, facilitate services, and advocate for students. For example, you may be working with a student whose parent smokes, and that parent's cigarette smoke is a trigger for that student's asthma. Perhaps you can facilitate connections to smoking cessation support services, or, for example, if the family is faced with chronic mold in their apartment because the landlord won't fix leaks, you can help facilitate a connection with legal aid services in your community or housing rights services in your community to help the family address that trigger that they may not be able to address independently. And then also, school-based health center staff can be great advocates for students with asthma. For example, if there's a furry pet in the classroom, you may advocate for the school to adopt a furry pet policy where furry pets are not in the classroom, or perhaps you can advocate for smoke-free policies and multi-unit housing in your community, because you know that even if that family doesn't smoke and no one in that student's household is smoking, if anyone in the building is smoking, that student may be impacted by secondhand smoke. And so real-world example related to case management is CEASE, which some of you may have heard of and some of you may have even used in the past. CEASE stands for Clinical Effort Against Secondhand Smoke Exposure, and it's an innovative program to reduce the burden of secondhand smoke. Instead of the adult provider asking them if they'd like to quit smoking, the CEASE program found that if a pediatrician asked the parent during the child's visit, they have more success in getting the parent to cut back or quit smoking. So this program involves pediatric providers helping parents quit smoking using the Ask, Assist, Connect model. And if you'd like more information about CEASE, you can find that in the guide. And now I'm going to turn things back over to Anne, who will talk about strategies 3 and 4.
Great. We have a polling question before we get into strategy 3. And that question is, which of the following are potential sources that might trigger or exacerbate asthma in the classroom?
Thank you, Anne. If we all can take a few seconds to answer the question. Thank you. Five more seconds. Okay, thank you, everyone. 100% said all of the above, Anne.
Fantastic. All right. Well, children spend much of their time at school, and the school environment often contains environmental triggers that make asthma worse, just like the things that you just saw on the polling question. So, of course, school-based health center staff members are not responsible for maintaining healthy indoor environments in schools. But as the resident health experts for school communities, there is a role you can play to help ensure better air quality for students and staff. So the first step is increasing awareness, and that is ensuring that the entire school community can identify the sources of environmental asthma triggers on campus and can take simple steps to improve indoor air quality. The EPA has a website pictured here called Creating Healthier Indoor Environments in Schools that is really a go-to resource for easy-to-use tools. This site includes basic information for teachers, facility staff, school officials, and others on their role in maintaining healthy indoor air quality. And so as school-based health center staff, you can point the school staff to these resources to increase their awareness that each member of the school community has a role in creating either good or poor indoor air quality. So, for example, the maintenance staff person may not realize that the cleaning products they're using to control the spread of germs may also be triggering asthma attacks, and that there are safer alternatives. Or teachers may not realize that if they spray air freshener to get rid of the scent of sweaty students after recess, that they may actually be reducing the quality of air quality in the school. Okay, so conducting an assessment is the next step. And the idea of an assessment may seem daunting, but it can be as simple as providing teachers with a checklist for evaluating the conditions in their classrooms, or providing maintenance staff with a methodical way to examine school conditions. Here is an example of a simple checklist that can be used by teachers, and you, as the school-based health center staff, can be the initiator, can give this to teachers. Additionally, school-based health center staff may play a unique role in informally assessing air quality problems at the school, because you are uniquely positioned to track common problems without even needing a formal assessment tool. For example, do you have an unusually high number of students coming to you with asthma problems from a particular classroom or a particular area in the school? You may not always see patterns among students visiting the school-based health center, but staying aware will help you identify those patterns when they exist, and then you can bring that to the attention of school officials. All right, so once you have created increased awareness and done an assessment, it's time to support or lead an intervention aimed at improving indoor air quality and reducing exposure to environmental asthma triggers. School-based health center staff can partner with appropriate school staff to implement a wide range of activities, programs, and policies to both address existing problem areas and preventing new ones from arising. Many states have laws related to indoor air quality in schools. Some require the use of an IAQ management plan or components thereof. So as a starting point, school-based health center staff should learn about the laws in their state so that you can determine whether the school is in compliance with state laws. The Environmental Law Institute has a database of IAQ laws by state, and that's a great starting point, and we provide that link in our guide. And if you find that your school is not in compliance, you can help them. You can point that out to them and help them become in compliance. But whether or not it's required by law, school-based health center staff can encourage the school to develop a comprehensive IAQ management plan, and you can access model plans in our guide. So once a plan is in place, there are then a range of comprehensive approaches for managing indoor environments. The EPA offers the most comprehensive approach with their toolkit called IAQ Tools for Schools, pictured here. It provides simple, easy-to-follow guidance to assist school staff in identifying actions that they can take, with the real emphasis on identifying low to no-cost solution to the IAQ challenges that are common among schools. So to improve indoor air quality, school-based health center staff and partners can implement a comprehensive program, like Tools for Schools, or specific interventions targeting one or more particular environmental asthma trigger. And there are many reasons to consider starting with a particular asthma trigger. It may be that one particular trigger, like mold, is causing significant asthma problems in the school, or if you do not have support from school officials to implement a comprehensive approach, you may be able to start by addressing a specific trigger and then adding on components from there. Or you may have community partners that are willing to volunteer their time around a specific project. So ultimately, reducing exposure to any environmental asthma trigger in schools is a great starting point and will improve indoor air quality. So for example, mold is commonly found in schools, and while it's impossible to eliminate all mold and mold spores, mold growth can be controlled indoors by controlling moisture. And here is an example of one of many tools to help schools understand the various ways that they can control moisture and reduce mold. Another specific environmental asthma trigger that you might target is pests. So pests like cockroaches and rodents are very common in both homes and schools. And the important thing is to utilize an approach that is not going to expose the children and staff to harmful chemicals and pesticides. So integrated pest management, also known as IPM, is an approach for managing pests that reduces exposure to both pests and pesticides. It includes a lot of simple common sense activities such as installing door sweeps, blocking pest entries with steel wool or screening, possibly banning pets or foods from the classroom. So IPM is sustainable because it is a prevention-based approach and it has no long-term increases in costs. And the last example I'll share is cleaning products. So many cleaning products, like bleach, are asthma triggers. And some schools have successfully adopted the exclusive use of certified green cleaning products. So there are some organizations that are third-party certifiers, which means that they evaluate and then list products that are safer to use around children with asthma. And it's very important to use these lists, and you can find links to them in our guide, and not to just go by the label. We know that some products use the word green in their product name, but are actually quite harmful to both health and the environment. But by accessing the lists of asthma-safer products, as well as some tips for working with your school and school district on changing their purchasing policies, you can reduce a really significant asthma trigger in the schools. So there are other specific environmental asthma triggers that you could help the school address. Our guide includes sample policy on fragrance-free schools, for example, and as Janine mentioned, a sample policy on animals in the classroom. So one real-world example is that the Open Door Family Medical Centers runs 5 school-based health centers in New York. And they realized that some of the schools that they work with were not in compliance with state laws and helped them become in compliance by adopting policies on both integrated pest management and asthma-friendly cleaning products. And it was the school-based health centers that took the role in initiating this and then partnering with all of the other essential partners to make it happen. Okay, strategy 4. We have another polling question here, which is, if a patient's asthma is triggered by dust mites, what are ways to reduce exposure in the home?
Yes, and we'll give everyone a few seconds to answer. Okay, 5 more seconds. Okay, and we have 92% said all the above.
Fantastic, thank you. And you're right, it is all of the above. So it may initially appear that there is not a role for school-based health center staff in addressing the students' home environments because school-based health center staff rarely go to the students' homes, and many don't even have the opportunity to talk with parents or other family members. But as the healthcare providers, educators, and case managers, there are really many ways that school-based health center staff can support healthy home environments. So there is robust evidence of the effectiveness of home-based asthma interventions that include environmental remediation. So the gold standard really is that a systematic review of evidence-based asthma interventions was conducted by the National Community Preventive Services Task Force. And based on that review, they recommend the use of home-based multi-trigger, multi-component interventions for children and adolescents in their home. So this includes generally an assessment of the home environment, making changes to the home environment to reduce the exposure to asthma triggers, and then educating the whole family about the home environment. So given the strong evidence in support of this type of intervention, perhaps one of the most important things that school-based health center staff can do is to find out whether such programs exist in your community, and if so, to establish a system for referring patients. Now, some school-based health centers have found they have sufficient resources to conduct the in-home visits themselves. And one of the school-based health centers that's participating in our California Asthma Learning Collaborative that's based in Chula Vista, California, is actually ready to launch an in-home visiting program with their patients with asthma. But even if at-home asthma programs are not available to students in the area that your school-based health center serves, the staff can accomplish a lot through home-focused education. So if a patient's asthma is triggered by aspects of the home environment, there's a lot that you can do to educate the patient and family, if you're able to connect with them, about the changes that they can make to create a healthier home environment. So you already, through the polling question, demonstrated that you understand there are many things they can do to reduce exposure to dust mites at home. Another example is reducing cockroaches. Families can seal cracks or openings around or inside cabinets, fill holes with caulking or copper wools, and eliminate water sources like leaky faucets, as they often attract pests. And so the guide includes many of the tips, and there are also many free materials you can order to share these tips. Now, some of the actions that we encourage families to take to reduce exposure to triggers in their homes require purchasing specific products, and this may place a financial burden on families. So some asthma programs have been able to acquire donations of products or grants to purchase products for families. And examples include things like allergen impermeable mattress and pillow covers, or some of the non-toxic cleaning supplies. And in our real-world example, the John Peter Smith Health Network runs 20 school-based health centers in Texas. And they have worked with community health workers to conduct home visits with patients with asthma and do a home allergen assessment and make recommendations to the families on changes they can make. So this can be done by school-based health centers. And for our last strategy, I'm going to turn it back to Janine.
Thanks, Anne. We also have our last polling question, which is around sources of outdoor air pollution. Which of the following are sources of outdoor air pollution that might worsen a patient's asthma?
Okay, we can just take a few seconds to answer. Five more seconds. All right, Janine, we have 96% that said all of the above.
Awesome. That is correct, all of the above. Every year, millions of pounds of chemicals, gases, and particles are reduced into the air by vehicles, power plants, industrial and agricultural activities. Here in California, we've had a record wildfire season, and as a result of the thousands and thousands of acres of fires that have burned this year, many parts of our state have been experiencing poor air quality for months, actually. And while it may seem at first glance that school-based health centers don't have a significant role to play in improving outdoor air quality, there is, in fact, a lot that you can do around assessing, increasing awareness, and advocating for policy changes that can serve to improve outdoor environment for your students. So first, I'm going to talk a little bit about conducting an assessment of local air policy, of local air quality. So an important tool is the Air Quality Index, and you can see a screenshot here. The Air Quality Index is a great tool because it provides real-time local, regional, and state air pollution information and is available across nearly the entire United States. You can access Air Quality Index information at airnow.gov, and links to this website can be found in the guide. This website is run by the EPA and other government agencies, and it provides daily air quality forecasts. If you want to get a sense of air quality trends in your region over time, there are data that are available as well that can give you an idea of how the air quality changes over the course of the year. And regardless of the source that you use to find out more about air quality data, think about some questions at your school site yourself. Think about traffic congestion during pickup and drop-off times, buses idling. Is the school located near a major roadway? Are there industrial facilities nearby? There are many things to consider when you're thinking about assessing your local air quality. And once you've conducted an assessment and you find that perhaps low air quality is common in your part of the country or in the community surrounding your school, you might want to partner with the school to implement programs and policies that help reduce children's exposure to poor air quality on those days when the air quality is low. So I just want to draw your attention to the EPA's FLAG program. The FLAG program uses different colored flags to inform students, school staff, and community of the daily air quality conditions. So you can order the flags from the EPA's Air Quality Flag program, and there's curriculum and a handbook that goes along with the flags. Because in addition to making the community aware of poor air quality on that day, you also want to offer guidance for modifying physical activity, because we want to make sure that students are not exposed to environmental triggers that might worsen their asthma, but at the same time, we don't want to shut students with asthma out from participating in PE or other outdoor activities. We want them to stay physically active. So as a representative of a school-based health center, you can play a role in working with the school to develop modified or alternative exercise. The FLAG program is also a great way to involve students in your efforts to address outdoor air quality. One of the schools that is participating in our California Learning Collaborative, John C. Fremont High School in South Los Angeles, has student peer educators who they've recruited to check the daily air quality index and to raise the flag. So the students, and they've also received training in environmental asthma triggers as a part of the work that they're doing with the program. Next, I just want to talk a little bit about partnering with schools to implement programs and policies. For many schools, the greatest source of outdoor air pollution, which comes from the school site itself, are school buses idling and personal vehicles idling. So the risk associated with exposure to idling buses and vehicles can be reduced greatly by maybe one of the easiest interventions that we'll talk about today, which is simply shutting off the engine of the bus or the car. But changing driver behavior, we know, requires a mix of education and policy change. So it's important first that school-based health center staff educate the broader school community about the impact of idling and how idling impacts students with asthma. And finally, school-based health centers can partner with others in the community on clean air advocacy. So, for example, promoting healthy siting of schools and playgrounds, helping to reduce exposure to harmful particulate matter through the adoption of wood burning reduction programs, or advocating when it's time to replace older, more polluting school buses with newer alternative fuel vehicles. And I think it's important to say that school-based health center staff don't necessarily need to lead all of these advocacy efforts. There are many places where staff can simply be playing a supporting role. And finally, I'd like to talk about another real-world example at South Bay Family Healthcare Center. They run the Wellness Center at Carson High School in Southern California, and they are currently working with the school to adopt an anti-idling policy. And what they realized is the school bus drivers, because of the location of the clinic, were coming into the clinic for bathroom breaks. So they invited the school bus drivers to come and have a water break with them. And during the water break, they talked about the impact of idling, so they could start to get the bus drivers as allies when they're working with the school to adopt an anti-idling policy. So I felt like it was really a fortuitous example that the school bus drivers were already there, and they took advantage of their connection with those school bus drivers. So now I want to talk a little bit about upcoming opportunities. This is a picture of Christine Carter, who's a nurse practitioner at West Oakland Middle School that I mentioned earlier, and she's here with a student, Maurice, who is part of their group education program. So part of what we've done in developing the guide is also collect case studies to share out successes and best practices from school-based health centers around the country. So if you have a fantastic asthma program that you're already running, we want to hear about it, and we encourage you to take a look at the case studies on the RAMP website that accompany the guide. They are inspirational, and they really show from a practical perspective what school-based health centers can do to take the principles that we're talking about today and actually make them real in their clinic. On a related note, another component of our work is to convene a national asthma learning collaborative, as we've done here in California. So we'll be selecting 10 school-based health centers across the country that are interested in addressing environmental asthma triggers. The selected sites will each receive a stipend of $4,000 to participate in a year-long learning collaborative and implement a small-scale intervention to reduce environmental asthma triggers. So we will be releasing the RFA for the National Learning Collaborative in January and February. And so if you have been on this webinar and thinking about some of these ideas and thinking what's feasible in your clinic, and you feel like a little bit of money would help you to move the project along, we encourage you to participate in the National Learning Collaborative. It's really been a great way for clinics to learn not just from Ann and I and other experts in the field, but really from one another about what works to help reduce students' exposure to environmental triggers. So now we are going to open it up for questions. If anyone has questions about the environmental asthma guide or any of the examples we've talked about today, or would like to share something that they're working on, we'd love to hear from you.
Okay, thank you very much, Ann and Janine. Like they said, if anyone has any questions, we just want to also provide you with some information for Ann and Janine. Here's their contact information. If anyone has any questions, you can also email them. But right now, we do want to give everyone the opportunity to ask any questions. If you can type them in your question box, and then we will ask the questions right after we just make a few announcements. First, we would like to talk about our membership. School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based health care. Our members extend and support our work. We ask that you will please join us in this great opportunity. We offer two options for membership, individual or organizational. Organizational memberships are $500 a year, include discounts on professional services and products, letters of support, and newsletters. And individual membership is $100 a year. If you have any further questions, we ask that you please visit our site and go under membership, and there's more information. Also, upcoming our 2016 convention. Abstracts are due by October 26th. So if you are interested, we ask that you please include your abstracts and send them in to us by October 26th. All right, now we will open the floor for any questions that we have. Janine and Ann, we do have one, and it may be, there were just like some additional information that, or materials that you can recommend that they can provide to parents.
Great. Ann, would you like to take this one?
Yes, great. So what I'm going to suggest is that if you go to the guide, so download it, and also if anybody would like a hard copy, because if that would be easier to use with your colleagues, you can email me and I can send a hard copy. But if you go and you download the guide, starting on page 55 is an appendix of resources and tools. And it begins with educational materials that you can distribute. And some of those are for the kids and some of those are for the parents. So that would be a great starting point. And if you don't find what you're looking for there, email me and we'll connect you with additional resources.
Thank you so much, Anne. We also have someone that just want to, and maybe you can kind of elaborate, just to remind everyone that just because a cleaning product is labeled environmentally safe or green doesn't mean it is.
Absolutely. That's such an important point, and I'm glad that one of the participants reiterated that, because some of the products actually have the word green in their title, and they are not at all environmentally friendly. So we really want to encourage folks to go to these third-party certifiers. So EcoLogo is one of them, and there are other lists in our guide, and to look at what they have listed as the asthma safer products. Now, not, cleaning products are not fully safe, but asthma safer products, because they have actually evaluated them and looked at the ingredients, and that is the list to use. We also, on our website, and listed in the guide, have an advocacy toolkit for advocates who are interested in working with their school district on making a voluntary switch to using environmentally safer cleaning products. And the California Department of Public Health recently released toolkits on asthma safer cleaning that includes an array of resources both for advocates and schools.
Thank you so much. We don't see any more questions or comments at the moment, but we are so appreciative, and thank you for informing us about the 5 major strategies and programs and tools that school-based staff can use to work with the schools and families, and especially our communities. They definitely play a big part in helping us in as far as, minimizing asthma and triggers and just seeing what the effects it has. We really appreciate it. And we do have a few more poll questions for our attendees. After this amazing presentation, we would like to ask you, did this presentation meet your needs? If you can please answer yes or no. And we'll just give you a few seconds. Okay, 3 more seconds. Okay, our next question we have is, how well did the presentation meet the stated objectives? Okay, we'll give you 5 more seconds. Thank you, everyone. The next question we have is, how likely are you to apply information from the presentation in your organization? If you could just take a few moments to answer the question. Okay, in 5 more seconds. Okay, and our last question. Would you recommend this webinar to others? Just take a few moments. Okay, and we thank everyone for doing these poll questions for us. All right, again, if you have any more questions, we just ask that you definitely contact Janine or Ann, and we also, or you can contact us through School-Based Health Alliance at info@sbhforall.org. And we thank everyone for attending today. And just a reminder that this webinar has been recorded and it will be uploaded to our website in 3 to 5 business days. Again, Janine and Ann, we appreciate everything, and everyone have an amazing day.
Thanks,
Thank
Tiara,
you.
and thanks, everyone.